is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. So today I'm pleased to be introducing to you Kristen Tuttle. She is a nurse care manager for Oncology, and with her is Sarah Gemley, who is the manager of care management. So today specifically we're going to be talking about oncology care management. So thank you both for being with me today.
Thanks for having us, Jill.
It's a very interesting topic for our community. You don't really know much about it until you need it, and so it's wonderful to be talking about it. So Sarah, maybe you could start off and tell us a little bit about what is care management?
Sure. So care management is a group of services provided by usually nurses and social workers. We at NMC have nurses and social workers in lots of different places within our organization. So we have folks in the hospital that help plan for discharge from the hospital, help maybe apply for resources, insurance, that kind of thing, help you get what you need from the hospital. We have a nurse care manager in the emergency department, and he helps with discharge planning from there, and also folks that need resources from the emergency department. Then we also have teams in primary care now at Northwestern Primary Care and Georgia Health Center. So they help with the same sorts of things, whether it's insurance, resources, maybe help affording food or anything like that to do with healthcare. And then Kristen's role is unique. She is the nurse care manager for our oncology and palliative care services, with most of the focus on oncology and cancer care here in Franklin County.
Wonderful.
Yeah.
And so what's your thought on care management, how that improves the quality care?
Oh, sure. So we touch everything.
So why do I have this?
Right. So what's really amazing about care management in general is that we tend to have a foot in every sort of realm of healthcare. So we help with the financial part, both for our organization and helping have lower cost, higher quality care in a variety of ways. For people in the community accessing care management, often what that can mean is quicker access to resources that you need. It can also mean sort of translating some of the medical things going on with someone and how to navigate the healthcare system. It can be extremely confusing, so we help with that. Also, people in crisis. So if you're having a social crisis of some kind, and whether it lands you in the emergency room or in primary care, you're trying to take care of your diabetes or heart failure, and there are social things getting in the way, can't afford medications, can't afford insurance, those kinds of things, we intervene and are able to help there. So overall, we help with things like having efficient movement through the hospital. So helping people get to the right level of care regardless of where they are. So in the emergency room, if they don't need to be admitted, we help find alternatives to that. In primary care, if they're not doing well at home, helping them find someplace else to be or other resources that might help support them better at home.
Wow, so
that
just,
kind of thing.
Total wrapping around the
All
patient
around.
and
Yeah.
to make sure they get the best care no matter where they are.
Absolutely.
Including in their home and in their community.
Exactly.
So that's wonderful, and you're connecting with all of the other community partners as well, because we don't provide
Absolutely.
all these resources at the
Right.
hospital. You're really connecting with the community and the resources
Absolutely.
available.
Absolutely.
So I love that networking with that community. That's pretty cool
Definitely.
stuff.
Yeah.
So Kristen, what is your role? Tell me a little bit about that.
So I'm the RN care manager for the oncology patients. What that means is when there's a patient in the community that's been diagnosed with cancer, I get a referral, sometimes from doctor's offices, sometimes directly from patients, sometimes from inpatient staff, to connect with these patients, make sure that they're getting their needs met, their basic needs, so food, shelter, finances, and also the psychological piece. Having a cancer diagnosis is a big change and a big challenge for people. So having someone who has experience in oncology, who knows the process a little bit and sort of how things usually move through, can be of great comfort. To have somebody who just is non-judgmental and understands and can sort of walk people through a little bit. I think the idea of the position is to have a point person, because the oncology offices are separate from Northwestern, to have a point person through the hospital to be able to be kind of a liaison and make sure that they're getting to all their appointments and getting all of their needs met.
Wow. So is this a new position, and how long have you been in it?
It's not a new position, but it's the first time I think that there's mostly that there's been an RN in the position.
Right.
It had previously been a social work position. But because I'm an RN who's got a lot of oncology experience, I'm able to pull that into it and sort of, blanket both sides of things. I've been here at Northwestern Medical Center since the beginning of the year, so since January.
Okay. So your background, you're a nurse, but tell us a little bit about your experience. What makes you so qualified here? Sounds wonderful.
I've been an RN for about 20 years, most of that in oncology, palliative care, hospice and home care. I've worked in bone marrow transplant. I've worked in little tiny private offices giving chemo. I've worked in big sort of famous cancer centers in bone marrow transplant. So I've also worked in home care here in the community. So I sort of know the process and who to connect people with and sort of what to expect. And a lot of times the biggest, scariest thing about having a new cancer diagnosis is that, what do I expect? I don't know what's next. And being able to support people through that, it is helpful.
So did you always want to work in cancer care? You've been in it a while. What drew you there?
I actually honestly got there a little bit by mistake. I had applied for a med-surg position at a hospital when I first got into nursing 20 years ago, so a lot younger. I applied for the position, I interviewed for a med-surg position, and they said, now that we've met you, we sort of have this other position that we think that you would be great for. Would you be willing to try it out? So I worked inpatient in a pretty big hospital and on an oncology floor, and as soon as I started doing it, I was like, oh, this is what I'm supposed to be doing. So it was sort of by mistake, but sort of this homecoming feeling like, oh, now I get it.
Well, I love your passion, and I'm sure the patients feel that warmth that you have and helping them through this process.
Thanks.
So that's really cool. So how do you work with the care team? There must be a team that wraps around a patient that has this level of diagnosis. So
Yep.
how do you fit and how do they get to you?
Yep. So right up at the beginning, usually at diagnosis, there's either been some scans that were done that are letting people know that there could possibly be a cancer, or some other testing like a biopsy. And once there's actually a diagnosis of cancer, I get a referral and I reach out usually and contact patients. I work with the people in all of those offices, so I don't sort of take over all the patients. I work with the care managers in the primary care offices. I work with the folks in the surgeon's offices and the specialty offices, so folks either go down to UVM for some cancer care there, or they get seen up here by Dr. Sanders and the Champlain Valley Oncology and Hematology group, who sees folks up at Doctor's Office Commons twice a week. So I'm here Monday through Friday. I'm available every day, pretty much regular business hours. I can be reached through the switchboard at the hospital, or sometimes I get referrals to inpatient. So if somebody's been newly diagnosed as an inpatient, the inpatient care management team will pull me in that way. And I don't try to take people over, but I try to be a resource, because I do know a lot of the ins and outs on how to find special funding or special programs, or what the next step is and what people need, and sort of try to keep things moving along in a timely fashion. So I sort of plug in as a resource to everybody and just help keep the ball rolling and keep everything moving.
So does a patient have to be a patient of NMC to actually get your service? I mean, how does a patient get to you?
Yeah, they can self-refer, and no, absolutely don't have to be.
How do I know you exist?
I guess just as part of the care management team and part of what's being offered. I do meet people when they come for chemo in Dr. Sanders' office. I do physically meet people sometimes when they're in primary care office and are getting a diagnosis or conversation about a new diagnosis. And if folks are inpatient, I get pulled in to come and meet them for the first time. And then after I meet them, I'm really available to do anything. If it's you need help filling out a Medicaid application, or you need to apply for food stamps, you don't have somebody to give you a ride to your appointments. I sort of see my position as removing those barriers and trying to make it so that your availability to all of your cancer treatment is as easy as possible, because having a diagnosis is already hard enough. So if I can remove some of those barriers and just make it a little smoother and easier, I feel like I'm really doing my job well.
I love the energy. It's great. So how many times can I use the service? I mean, because once you have a cancer diagnosis, you have quite a journey potentially, or you might need to reconnect on it, if you go into remission and then come out. So what, what service do you provide to actually connect with that patient, and how often can they actually use your service, I guess?
So there's no limit to how often you can use the service. I am available, like I said, Monday through Friday, and I'm available to any patients in Franklin and Grand Isle County. So any place that Northwestern services, I'm available to them. I do tend to focus on areas of peak stress, so at diagnosis, at start of treatment, maybe towards the end of treatment when folks are starting to pare down on the number of visits, and then at beginning of survivorship. So when you go from getting chemo every week and seeing this group of staff a lot to all of a sudden being on your own at home and not seeing as much staff, there's sometimes a transition period there as well. So I do sort of focus my attention on those peak stress times, but I'm always available. So if something comes up, down the road, I do reach out a little bit for our support groups, because I manage the Healing Circle Women's Cancer Support Group here at Northwestern. So in survivorship, we reach out to those folks as well.
That's great.
Yeah.
So do you have any stories or experiences that you can share?
I do.
Not individuals, but just so people can get a sense about this experience?
Yeah. Being pretty new, most of the patients that I've started working with since I've got here are still in the midst of treatment. But I do find that I've been able to connect with patients. If I connect with patients early and sort of go through the journey with them, I've had folks that have come in and have just really had a hard time with the insurance system, and being able to call their insurance, verify their benefits, and go back and say, you've got a $700 deductible, but after that your stuff is covered at 100%, so let's find some funds to fill that $700 so it's not a burden to you, and after that we'll know that you're covered until next year. Next year we'll talk about it again and see where things are at. Just that little piece that maybe only takes 15 or 20 minutes can be huge for somebody, because for 2 weeks they've been sitting home worrying about how they're going to be able to afford this and not being able to focus on healing and getting better. So just something that seems really simple and is just a phone call or two can make a really big difference.
You're a real partner,
Yeah.
Yeah. So that's so important. Is there anything else that you want our viewers to know about this service that you provide, or the services provided, whether it's specific to oncology or care management, because folks are going through so much, and to know that you're here to guide them is fantastic.
Sure. I think the biggest thing is really, if you find yourself feeling like you are working too hard to access something, working too hard to get an answer about something, feeling frustrated that something's not making sense, whether it's about your health care, about insurance, about resources, there is, I can almost guarantee, someone in your clinician's office who can help you. And it doesn't have to be through NMC. Our clinics and everything are well supported, but so are most of our clinics in the area. So a lot of the primary care offices now have care management. There's social work connected, and nurse care managers connected to most aspects of healthcare. Could be through your insurance company, could be through our clinics, could be through the hospital, emergency departments. So it's just really, I want to make sure people know that if you have a question, there's likely someone out there who can help you find the answer.
That's terrific. Yeah.
Yeah.
Thank you. You have a big jobs, and both of you, and so just quickly, because our time is definitely running out, but what do you do to balance this? Because you have to come in with really this good energy for folks, and so you have to replenish. So what do you do?
That's a great question. Kristen?
How do you stay healthy?
So my husband and I raise most of our own food. So we raise beef, chicken, eggs, and pork in our spare time. So I'm usually pretty active outside of work. But we do a lot of interacting with animals and not so much with people. I sort of feel like I save up all of my good, positive energy for people because I spend most of my time with animals when I'm not working.
Well, that's certainly a great distraction for sure. You can pour yourself into.
Yeah, I think just the environment in Vermont, there's so much to do and so much, there's really 4 seasons and you can experience all of them. My family is a huge support, and I just think, the team that we have at NMC is fuel enough most of the days. So they do an amazing job, and I'm really, really proud of all the work they do.
Thank you. Thank you so much. Well, I'm very proud of the work that you're doing and really wrapping around all of the community to provide them support as they go through their life's journey and some very challenging times where you're really providing hope and healing and real help to get them through. So thank you both very much.
Thank you.
Really enjoyed talking with you.
Thank you, Jill.
And I'm Jill Berry Bowen, CEO of Northwestern Medical Center. Thank you for joining HealthBeat today to talk about oncology care and care management. And I've just learned that don't be afraid to ask. If there's a question that you really can't find an answer to, give these folks a call, because we're here to help and to make your life journey as easy as possible, and specifically around care for cancer with hope and healing. Thank you.